So we're very excited about the synergy data that we're presenting at ASCO this particular session. The data there is revealing that we have a treatment benefit in patients that are the most vulnerable. These are patients that are at risk of a poor outcome. And what we have identified in this retrospective analysis of the data is that there is a reduction in the risk of death of 27%. It's very material for these patients. As you can appreciate, these are patients that have a risk of passing away fairly early, and they go through their therapies very quickly, and it is the most vulnerable patient population in prostate cancer. The other trial that we're very excited about is one that is receiving an oral presentation, a very similar result, where patients that are at risk of passing away early, again, seeing that same sort of trend in poor prognostic patients doing much better than the rest of the patient population. So you have two drugs with the same general outcome in two very different circumstances of disease indications. Both of these represent an opportunity for us, I think, to address what is generally occurring in this conference, which is a tendency towards identifying patient populations that are most likely to respond to therapy. We've seen this in a uro-oncology setting with a STAMPEDE trial, where patients are identified as high risk, and those patients that are receiving chemotherapy early on in the disease setting also seeing a benefit from chemotherapy. So I think generally we're starting to see this trend now in cancer therapy where patients are being identified where we can apply therapies that are going to give them the best response. And so I think the results from the Synergy trial in identifying patients that are at risk for poor outcomes in the Synergy trial for prostate patients, and the same outcome with Apatorsen in the Borealis 1 study that is being presented tomorrow, same sort of outcome for us.